The drugs that are on the streets now are different even from what the drugs that were on the street 10 years ago.
Harm reduction advocates are raising the alarm as the number of drug toxicity calls paramedics have to respond to continue to rise. The Manitoba Health Coalition calling on the province to do more after a substantial increase in drug poisoning incidents in the first 2 weeks of July this year compared to 2022.
It doesn't matter if you're a hardened drug user. It doesn't matter if you're someone who is experimenting with drugs for the first time. The potential is there for an overdose and for death just because of the toxicity of the drugs that are on the streets right now.
Data from the city of Winnipeg shows the Winnipeg Fire and Paramedic Service responded to 183 calls that required the use of naloxone between July 1st and July 16th, compared to 108 during the same period last year.
Month to month, our incident count and the toxicity and the lethality of the drugs we're seeing is on the rise for sure.
It's why the Manitoba Health Coalition is now calling on the provincial government to allow safe consumption sites in the province.
The government's opposition to supervised consumption sites is purely ideological. The evidentiary case has been more than made.
Safe consumption sites allow people to test and use already acquired drugs under the supervision of trained staff in a bid to reduce overdoses related to tainted drugs. Manitoba is an outlier. It's the only province in Western Canada that doesn't have a single supervised consumption site.
There's been an increased stress on staff who have been put in, or who are in situations of saving lives that they weren't normally trained to do and weren't supposed to be doing in their daily work.
We don't have supervised consumption sites, but yet we are still experiencing a lot of overdose situations.
According to Health Canada, there were 4 million visits to safe consumption sites between 2017 and March 2023, with nearly 70% of the substances consumed containing opioids like fentanyl. During that same time period, 0 deaths were reported at those facilities. City News reached out to the province regarding harm reduction and the lack of safe consumption sites in Manitoba. They did not get back in time for broadcast. WFPS says in order to find solutions, reducing the stigma around substance abuse is key.
People that live in neighborhoods can hide their addiction in their big fancy home. And if you pass somebody on our street, self-reflect and ask yourself, how do you view that person? What is your bias? Do you have a bias? And everybody has a story.
In Winnipeg, Djan, City News.